Okay, we are about to begin now. Please take your seats, all of you. Every year I tell you what the Pentathlon is about, what the power of 5 is about, but this year I'm going to ask you a question. Why do you think 5 is a very, very important number in the AIOC? Any one of you? Every time I've told you why 5 is an important number as far as history is concerned, religion is concerned. This time I want to ask you, why is 5 an important number as far as the All India Conference is concerned? Anyone? Yes. Mutti, you're going to punch someone at the All India Conference? That's what we stand for? No. Yes, absolutely. Feroz, your Mutti, I'm sorry, with your bone structure is not very impressive. Anyone else? Okay. Since we are running short on time, I'm going to tell you why 5 is important. The answer is very, very simple. 5 is important because it is the number associated with Pentathlon, undoubtedly the best show of the AIOC. Can I have a round of applause for that? And this year, the Pentathlon is very, very important because this year, it is all about women power. We have 5 teams, out of which 4 teams are being led by women, captained by women. And the 5th team has been created for the women and aptly called the eye candies. So,
but eye candies, all men. Yes.
So,
Yes.
yeah, so,
what did he say? What is unfair? Yeah, they are eye candies. They are
For
the men.
you.
That's for you. I've created them for you, Feroz. I thought I would get a thank you from you.
so,
So we have the team. We are going straight away into the team. Team Eye Poppers led by Tinku Bali. And we have Tinku Bali, we have Prafulla Kumar Maharana, we have Ikeda Lal, we have Ashish Lal and Dupur Goel. Stand up and wave like celebrities. The rest of you, please clap. Team Eye Poppers, we have led by Vinita Ramani. We have Dhanashree Ratra, Daivat Shah, Vinita Ramani, Shalini Mohan, and Lipi Chakraborty. Oh, Arshi. Dr. Arshi will be there in place of Dr. Daivat. Please take note. Dr. Arshi will be there in place of Dr. Daivat. Daivat. Team Eye Washes is led by Dr. Ragini Parekh. And we have Dr. Ragini Parekh, we have Dr. Ragini, we have Dr. Sumit Lahane, we have Dr. Nikhil Balakrishnan, Dr. Zain Khatib, and Dr. Aniket Ginodia. All of you here, please wave like celebrities. Next, we have Team Eye Catchers led by Dr. Chitra Ramamurthy. And along with her, we have Dr. Murlidhar Rajamani, Dr. Tamil Asari S., Dr. Dipti, Dr. Feroz. And now, ladies, here is your eye candies led by Dr. Anurag Mishra, the only I saw among those candies. And then there is Dr. Vardhaman Kankaria, Dr. Tushar Om Prakash, Dr. Samaresh Srivastav, and Dr. Rushad Shroff. Ladies, can we have a few whistles? Dr. Meeta, where are you? Can we have you whistling, please, for them? My co-moderator is Dr.
eye washes,
has been introduced. My moderator has still not had his cup of coffee, so he can't see the eye washes. But my moderator is an excellent moderator, Dr. Shugato, and I'll call upon him now to introduce the judges.
Yeah, so can we call upon our judges, Dr. Professor Lalit Verma, sir, Dr. Maskati, sir, Dr. Vatika Shah, Dr. Mahita Sharma, and a big hand for Dr. Sushmita Kaushik, who has joined in without notice. Thank you, ma'am. Thank you for being. Yeah.
The rules are very simple. We have 5 rounds, 1 round of video, followed by the round of quiz, and then there is an X tempo, which is called just a minute, and then there is a scramble and scramble. And we have last but not the least the celebrity eyes. As we go along, I'll be introducing the rules. But the rules for the audience, there's a rule for the audience too. You need to clap, you need to shout, you need to whistle, you need to bring the roof down. That's the only rule for the audience. So can we start with the video round? And the first team to go will be Team iPoppers.
And it will be 1 minute video, general marks, 25 marks for each video. So Dr. Tinku Bali is doing the video for iPoppers.
Set the timing to 1 minute, please.
Oh, please, they've started. Can you
Judges
go
will be
back,
marking
please?
her
Can you
on
restart
25.
the video? Can you restart the... So this is the saga of a young man who presented to us... Okay. It's not coming here. No, it's not projected on the screen. It's not projected on the screen. Please go back. Please start the video again and start the timer. So this is the saga of a young man who presented to us 2 weeks following a road traffic accident. He presented with a vision of hand movements, a dislocated lens, vitreous hemorrhage and retinal detachment. The dense vitreous hemorrhage was cleared. Here you see the lensectomy was done. And we could see a fold of retina and an area of retinal incarceration. The vitreous in the periphery was trimmed, hemorrhage was removed. So the retina became more mobile after that. The area of incarceration, we did retinectomy over there. Fluid air exchange was done and the retinal fold was gently ironed out to settle the retina. Laser was done around the retinotomy and the retina attached. 2 weeks later, the patient was taken up for lens implantation. A retropupillary iris claw lens was implanted, it was enclaved, and the IOL was successfully implanted. The patient regained his paradise. 6 months later, he had a vision of 6/9.
Just one question from one judge. Quick question, quick answer. No questions?
Did you think of putting any band? Because immediate paradise may have been regained, but it can be lost again. Because video showing is very good,
Dr.
but
Dhanasri Ratra?
because traumatic
Please be
patients
prepared
who are young, long-term PVR is very well known in such patients.
So in
Did
this,
you think of putting a band or not?
in this patient, I could visualize right up till the periphery. I was pretty confident that I'd removed the membranes. There was no preoperative PVR, so I did not
I would
think of
still,
putting a band.
if I was a surgeon, I would still put a band.
Sorry, Dr. Dhanasri, it's not you. It's Dr. Chitra. Just eye catch. We're trying to keep the judges thing so it'll be easy for them to mark.
Eye catchers. Next team is eye catchers.
Thank you.
Thank you, Dr. Tinku.
Somebody. can
Dr.
you come to
Vinita,
connect?
please come here and be ready for the next one. Yeah.
कोई आ जाए।
You're after her. No, sorry.
25 out of 25.
कुछ ऑडियो भी चाहिए। Start में। Okay, इसको full screen करना है ना? कैसे? Green ना? A very good morning. A very good morning, dear friends, and thank you so much,
Video and
judges.
time, please. Video and 1 minute time, please.
Thanks so much, judges, and here we go. Now, there has to be drama in life, and I have to connect with you on something.
Just 1 second. Timer has not come. Yeah. Our video is 1 minute anyway, but
Yeah. So, dear friends, I want to connect with you, show something very regular and routine, and the drama which comes. A polar cataract, there is no PC as seen already on the AIOS. So I just do all the right things. See, look, I do mechanical delamination, not a hydro delamination. Just watch. Minimal fluid. Haven't opened up the main incision. I'm just softening up the whole thing, loosening all the corticocapsular adhesions, and just, it was such a soft cataract, I ate it up. But you know, friends, anything can happen. The anterior chamber is stable, the IOP is 60, the cortex is being removed, so there is no vitreous disturbance as such. You just keep watching, but I just do always the right things for my team. Tricort is injected, just a gentle vitrectomy. You can't, you know there's a PC is given away, And look what I'm doing, friends. Would you dare to do it? I do a PCC in this case, and I implant a toric multifocal in the bag. And my patient, look at my patient. That's how it is. And that's how my team works, dear friends. Thank you.
That was brilliant. Any questions?
Toric IOL in a patient with PCR.
No, I have made a PCC. Toric. I have made a PCC.
I know. Still, it's a rent there, no?
Yeah.
It's a rent there.
If you
which is liable
overpromise, you overdeliver. And I have made a PCC, and the lens is sitting in the bag.
Unifocal IOL is okay, but toric lens can always shift, madam.
No, it will not shift. The PCC will stabilize it, and the bag is, unless the bag is a large myopic bag, when it might rarely rotate. Even in a normal situation, rotation of a toric IOL is only 4%. And here it is well seated, and the rex's overlap is there, and the haptics are well stretched, so there is no way. It is absolutely centered.
When two stalwarts argue, it never ends. So I'm going to come in here, and can I ask the third speaker? She's Dr. Dhanasri Ratra from Team Eye Openers.
Eye openers now, Dr. Ratra. Eye openers.
Start the video.
No. Good morning. No, it is started, but it's not coming here. Can you rewind again? No, not this. Yeah, good morning everybody. Now this is a young boy, and I'm going to show you the removal of a pearl like the cystic circus cyst. And here you see I'm inducing the PVD, and you can see how beautifully the vitreous has posterior hyaloid has come up. And after the core vitrectomy and sufficient vitrectomy, you can see one round subretinal cystic circus cyst. And here one retinotomy is being given to, and then I'm gently nudging the cyst with a soft tip cannula to try to move it towards this retinotomy. And once you can see the cyst has come out beautifully, and it is stuck to the flute needle. Now to remove the cyst is a problem because it doesn't come through this small sclerotomy. So I'm enlarging the sclerotomy so that we remove the cyst in toto without rupturing it. And you can see how beautiful it has come out, and you can see these undulations. This is a live cyst. You see we have removed the live cyst without breaking it. See how beautiful it is. And afterwards we do the fluid air exchange, do some laser and put gas, and that is the end of the surgery. Luckily the macula was not affected, so the child had good vision post-operatively. Thank you.
Dhanasri, the end of surgery with that cyst playing around in the aqueous?
No, that was on top of the cornea. To
It
show
was on top of the cornea. I
top
thought
of the cornea, yeah. Just to record the undulations.
Excellent surgery. I'm sure you must have ruled out neurocystic sarcosis.
Yes, it was all done.
And the other thing is that myth should be broken that it has to be taken intact.
Yes.
Nowadays, all of us see it inside the. We do not no longer take out the intact totocyst. We obviously take it out. For showing it's very good, and for doing histopathology is very good.
Yeah.
But otherwise, you can easily eat it out and have a lavage.
Yeah. Thank you.
So next we have Eye Candies, and did you notice Eye Candies is the only team who has dressed up according to their name, wrapped like candy paper? So you can start.
So we are going to go from the routine to the innovation now. So yeah, can I have my slide on, please? So let's get off to the new start. Yes. So this was a patient that we see always. It's a bullous keratopathy in the blind eye, having photophobia, watering pain due to recurrent epithelial erosions. The patient had already had a failed angiostromal, failed punctures, and he was advised Gunderson flap, which he refused because of the unsightly appearance. We have seen from the experiments that the silicone oil intracorneally had not shown any tissue reaction in the past. Therefore, we have actually used this hydrophobic nature of the silicone oil. This is a specific mask that we had actually created in-house with the PVDF, and with the femtosecond laser, we create a 280 micron intrastromal layer, and you can see that the silicone oil is being implanted in the intracorneal space. Then after that, this suture is put at the incision. You can see that entry to the silicone oil, because of the hydrophobic nature of silicone oil, the cornea has become quite compact, and the epithelial erosions have completely gone. The patient is completely asymptomatic even after 1 year of the procedure. We have clubbed this together and published it in Cornea recently. Thank you so much for your candidation. Thank you. Yes.
Excellent. Judges, any question? One question.
Guru Sheikh.
Morning, Dada.
I mean, there are several ways to skin a flap. If you have a femto,
Yes.
use it, that type of thing. But little cheaper ways also do work.
Yes,
yeah.
absolutely, sir. I agree. But we thought that this is the first time, so let's do a very predictable way of creation of the hair. Yes.
Okay.
Thank you so much. Thank you. Thank you.
Thank you. That was brilliant. And now we have Dr. Ragini from Team AIOS.
Can we connect it? Okay.
1 minute.
Yes, sir. So as we can see, this is a patient who has a subluxation, and it is enough for us to go ahead and do the phacoemulsification. This is a rhexis. We decide to put in a CTR ring first. It can be put before or after. And here we do a very gentle hydro procedure and proceed with the phacoemulsification. Phacoemulsification is done very carefully. The bag complex is unstable, so capsular hooks are used to even for more stability so that we can do a phacoemulsification well. This is a stop and chop technique. Now that the bag has been stabilized, the pupil has remained dilated, you go ahead with a very, very careful phacoemulsification and complete the phacoemulsification. As we can see. For want of time, we have skipped the steps of cortex aspiration. The IOL is placed and the axis is aligned, and the patient is given the results that the patient deserves even after subluxation.
Judges, any questions?
Dr. Mohita, any questions?
Nicely done.
Thank you. Thank
So
you
I
so
guess
much.
that was self-explanatory.
Thank you so much.
And now we'll go on to the next round. Judges, you can relax now, no judging. I have two people here to keep the score. We have Dr. Jayashree and Dr. Haimanti, and now your job begins.
Yeah, so the quiz round, there will be rapid fire quiz for right answer, plus 10, for wrong answer,
Dr. Prabal Maharana, you can come up
minus
there.
5. Right answer, plus 10, wrong answer, minus 5.
You're going to be asked questions, 10 questions in
Praful,
1
come
minute.
over to this side. So Praful is from Eye Openers. So you can choose from any of these 5. It's line for you. So Praful wants to hydrate
It's eye
with
poppers.
the soha. Eye poppers, yeah.
It's eye poppers.
poppers.
Dr. Prabal from eye poppers.
So-
Where are you going to ask the question?
Let's see. Yeah, you can go to that side. So Praful will be doing soha, and he's say D for you.
So, Praful, there are questions. If you can't answer, say pass because you've got just 1 minute, as much as you can score in that 1 minute. Shugoto, can we start?
Yeah, just
Can we start now?
and 1 minute time, please. So diagnosis, very easy questions this time.
Pass.
Pass. Next question.
Diagnosis.
Diagnosis, yeah. Heterochromy iridis.
Sorry.
Heterochromy iridis.
Diagnosis.
Von
Please don't
Hippel-Lindau.
drop. Sorry.
Von Hippel-Lindau disease.
What test is being done?
Pass. Oh, sorry.
Next.
Identify the one shown in the picture.
Pass.
Next.
Identify the device.
Morse's ring for aniridia.
Difference in the appellation pressure. This graph is showing what?
Corneal hysteresis.
Which test is being done?
Dominant eye.
And Hawkeye's post vision is used to train which structure of the
And time
eye?
up. This
Sir.
is the last question
Pass,
for you.
yeah. Pass.
Pass.
Can we have
Okay.
the answers now?
Yeah. So this was madarosis.
Didn't
He
get
gave
it.
pass 0. This is ectropion EVV 0. The diagnosis was tuberous sclerosis, so minus 5. Yeah, but
That's
no,
why the
that was
minus
not.
5. He's
Minus-
giving a He's ready to
Yeah.
fight for anything. He's getting a
So
minus 5.
this is Bagulani's test. He's minus.
He got a minus.
Yeah.
Just because you're looking like a bubble
Yeah,
gum doesn't mean you act like a kid. Judges heard what he said. He said
Zero.
minus 5, sir.
Yeah, 0 for this one. This is 0. This is the OmniView dual optic IOL. This is plus 10, plus 10. This is plus 10, hysteresis. This is dominant eye, plus 10. And this is for extraocular muscle training. So he got 25. So if you want...
So eye poppers, you get
Very-
a 25, and that's quite something. No one scores in Shugoto's
Very, very well
quiz
done.
usually. Next one,
Eye catchers.
Muralidhar Rajamani. Go there, please.
So are you the glaucoma guy? Yeah. So Brimolol he has chosen. Let's see
Dr.
whether he
Ashish,
can
come.
take the pressure off the
Can you
team
pick up?
with good marks and B. Will we set B for you? Daro. You get confused হয়ে যাবে. Set B for you. Can I have the screen, please? And the time starts now. Which AGV is this?
Oral lab aqueous drainage implant with stenting suture or Barwelt implant, both are the same.
Name the condition. Please don't prompt. You can pass if you want time.
Trichiasis. Yeah, pass.
The nodules.
Lish
name.
nodules.
What lens schematic diagram is shown?
Pass.
Child presented with irritability, lethargy, vomiting, and retinal hemorrhage in multiple layers. Your diagnosis, suspected diagnosis.
Terson syndrome.
What test is done and for what?
Titmus fly test.
For what?
Stereopsis.
Varenicline is the new FDA drug. How is it administered?
Pass.
What test is being done and suggested diagnosis?
Repetitive nerve stimulation test, myasthenia gravis.
And Charles Kellman, father of phacoemulsification, popularized what else?
Chopper.
Time is up.
Pass.
Yeah. So I'll go on to the question. This is right. Plus 10. This is dystrichiasis. He answered trichiasis, minus 5. No, he answered.
Pass.
Okay. Leash nodule plus 10. No, we'll take the final answer, so it's 0. That's what, yeah. So this is light adjusting lens schematic diagram. This is shaken baby syndrome or abusive head trauma. So this is plus, that he passed, so 0. Oh, minus 5. Minus 5 for Tarzan, he said. Right, thank you. So this is Tidmus for stereopsis, plus 10. This is use nasally, 0. This is plus 10. And this is cryo. He popularized, though he was not the inventor, but he popularized cryo.
So what do we have to
minus
score?
5. No, minus 5 for
Minus
this.
5 for this.
No, chopper. He
He
said
said
chopper.
chopper.
He
Okay,
said
Dr.
The score is
Dr.
30.
Chitra,
30.
I don't know about the judges,
Score is
but I'm
30.
giving you extra 5
So,
for your
well done.
For
leadership.
eye catches, the score
30,
is 30.
So, eye openers, you can choose from here.
Fast.
This was AIOS?
So, you are choosing Soha eye drop.
Which one?
And your set is
ये
A.
कौन सा था
Set
अभी जो
A
बताया?
for the eye openers.
So next we have the eye openers. Can we start?
Yeah, okhane delay.
Okay.
So, all are easy questions. Time starts now. What procedure is being performed?
Trab and trab.
Trab and trab, she says. Next.
What is the other name of erysipelas?
OCP. Okay. Pass, please.
Pentacum ectasia is named after
Berlin.
whom?
Bad.
Sorry?
Bad.
Pat, she says. Next.
What test is being done and for what condition?
For for ptosis, but I can't name. Please move on.
Sorry?
For ptosis.
What test is being done? That was the question.
No prompting, please.
Pass.
Diagnosis. You see the typical sign of some skin.
Pass.
What test is being done and what is the diagnosis?
Hair start.
What is the diagnosis?
Browns.
Time up now.
I'll give the question because I started it. So, what was the profession of Bechet? Bechet Stad, what was the profession? So, yeah, time is up.
Do we
So,
have the
I'll
score? Has she
name this instrument for the audience. Okay, and where is this injected? Again for the audience. Intercameral for bematoprost. Good. So this is abexternal-trabeculotomy, will give +10. This is St. Anthony's Fire, you said something else, -5. This is Bellin Ambrosio, -5.
I said Bellin.
You said Bal.
I said Bellin and then I said
You
Bal.
said bad.
Bal.
change it?
We take the
Yes.
final
You have
answer.
to stick
Yeah.
to what you've
Yeah.
said. You have to be confident.
Yeah.
Yeah, okay.
So -5. This is ice test for myasthenia gravis. So -5 for this. This is pass. So it's lymphoma, leper skin test. This is Hess will give half marks, and that will be taken away because she said Brown's left. This is orbital fractures, so 0. And he was dermatologist. Okay.
So do we have the score?
This is the
-5.
tonometer.
She has a -5. That's okay. You'll make up in the other rounds. You have some brilliant
And this
people
is
in your team.
intercameral.
So now we have Dr. Tushya Om Prakash, I think. Okay.
-5.
Why hasn't Dr. Tushya come? He saw the green
This was
top
I-
T-shirts and decided to run away. T-shirts? I didn't ask him to wear a sari.
So Rushad has chosen eyesight plus.
Yes, please stand up, the white. See how he's insulting you?
What is your question?
This is no gentleman telling a lady like that just because she's your competitor. How shameful.
So Rushad is vitalizing his brain and starting the quiz with C. Yeah. And the time starts now. So name the ring. Please no prompting, please. You are helping your opponent.
No prompting.
Name the condition.
Blepharoptosis.
What is the diagnosis? Look at the eye movement and the diagnosis.
Medial rectus palsy.
Name the lens.
Crystal lens.
Name the condition.
Inverse hyperpan.
Name the device.
Pass.
What are the perilimbal dots composed of?
Pass.
These are Horner Tantra's composition.
I know composition.
Whose logo?
Pass.
And which muscles are involved in Marcus-Gunn jaw winking phenomenon?
Pass.
So this is Vossius ring. He said pass. This is epicanthus inversus. So -5. This is left internuclear ophthalmoplegia. You got it right, but yeah. So pass.
He said
-5. Chris, crystallines is 10. 10. This is Mocher's pupil ring, pupil dilator. I used a lot of this. And this is degenerated epithelial cells and eosinophils. This is NPCV. And this is pterygoid and levator superioris. So the score?
Score, please.
10.
So he gets a 10. That's good enough.
Good enough.
Okay, the next one. Dr. Sumit Lahane. Okay. Audience, let me share a bit of wisdom with you. You know, whether you can answer the question or not depends on your posture. When you are bent at the hip and at the knee, in other words, when you're sitting down, you know all the answers. Be straight, you'll know nothing.
SETI is there, yeah. Time starts now. So name the condition.
Cryptophthalmos. Complete cryptophthalmos.
Diagnosis.
Familial Drusen syndrome.
What test and diagnosis?
Pass.
What is being implanted?
Ologen implant.
What is the third component of Horner's triad? 2 is shown. And the third one?
Anhydrosis.
Whose logo?
Pass.
Name this person who was blind and prize is given by his name.
Pass. Pass, pass.
Name the sign shown.
Rizzuti sign.
Sorry. And what is the spherical equivalent of the IOL of 21.5 diopter with a 1.5 diopter cylindrical toric?
22.25. 22.25.
Okay, so that brings to the end of your quiz. So this is plus 10. These are drug-induced crystalline retinopathy, and those are the drugs which are there. So minus 5. This, he said, pass is DSA with carotid dissection where the arrow is given. Ologen is plus 10. This anhydrosis is plus 10. This is Size Saver's logo. He passed. This is Joseph Pulitzer. Judges from here answered. So he did say Ologen. So a prize for the judge. He did say Ologen. Yeah. And this is.
I said
No,
I said Ologen.
No, he said Ologen.
Ologen. And this you said Rizzuti sign is plus 10.
Yes.
And this is 21.5 diopter. The toric IOL are given with the toric power incorporated as the total lens power. So that's something.
So it will be minus 5.
Minus 5, yeah.
Yes.
So
for
what's the
that.
score?
Thank you for the teams for helping me to calculate the marks along with the judges. Thank you very much. Yeah. So what
30
It's
is
a
the
30
score.
for him.
30.
It's a
Well
very
done.
good score. A huge round of applause for the eye candies.
Why to the eye candies? You don't have to show. I do agree they're good-looking men, but Hoymundi, behave yourself.
No, it's eye washers actually.
Sumit Lahane scored maximum.
Not when you
30.
say it.
Next is Prafulla Marana, 25.
No. They scored 30 as well. Chitra Mutti.
Murlidhar.
So we'll come to the
Yeah.
score at the end. So
Yeah.
the next round, we are going for the third round, and Ikeda, come up here while I explain the round. This is called Jam, which means just a minute. Each of them will be given a topic. This year, I have chosen some really absurd topics. And they have to speak on that. For just 1 minute, they have to speak on that. No repeating a word, no going ooh, ah, ee in the middle. Speak non-stop for 1 minute. You don't have to speak logic. Judges, you will judge them not on their logic, not on the sense, just on their speaking ability, the humor, not so much the content of it. So
1 minute of non-stop rubbish you can speak related to the, yeah.
each of you will get around half a second to
So, Idika, if you come over here and choose your favorite drug from Sun Vision's Sun Pharma, whichever is your favorite. So Soha is favorite of Idika.
Okay, so her topic is preferring, as an ophthalmic surgeon, preferring white cataracts over black cataracts is a sign of racism. Okay? So as I said, think absurd, think out of the box, but save your skin. You just might land up in jail. Right? Are you ready to go?
1 minute time.
Timer, 1 minute. And by the way, you have to speak on the topic. You cannot, disagree with what I've said. So she gets 1 minute. Timer again. Start.
Hey, why is
Wait.
Hey, why is this? Just say 1 minute timer. Yeah.
So, good morning. My topic today is preferring.
Timer, just wait, Ikeda, the timer has to come.
Can she
You
kill
are
time
giving-
by announcing the topic?
1 minute timer, please. Yeah, I know, but it's 1 minute timer.
You need to put the timer on. Can I have someone from Sun standing there, please, to help them and see? Okay, start.
So, preferring white cataract over black or brown cataracts can be a sign of racism. Now, racism is prevalent everywhere. We see what is happening all over the world. We see the kind of politicians who are coming into the power. So, when we are seeing this change all over the world, why not see the change and recognize it in our OR when we are operating? So when we see a white cataract, we feel so good. We have seen a white cataract. In our head, we are planning the surgery. We are going to go in, take out the fluid. It's going to be beautiful. We are planning the rexes beautifully in our head. But when we see a black cataract, we feel, oh my God, I will have to use so much power to deal with this cataract. We are scared of the cornea. We are thinking you need to use a chondroitin sulfate, use an OVD to save the cornea. We are already scared. We are telling our assistants.
Time's up. Time's up. Excellent.
Time up. I think that she said that very well, but I don't know whether she really proved the racism point, because I think that's the way every ophthalmologist thinks. So judges, you'll be marking her on 25.
25 from
And next,
poppers.
may I
Total of
call
25.
upon
Eye poppers. Yeah.
Dr. Deepti.
Dr. Deepti, you can choose your favorite Sun Vision drug. So Eyesight Plus. Yeah. Make sure she's writing that.
सर आपको ये लेना है? सर, you want this? और चाहिए? सर, chocolate.
This is something that we really, really need to think about. Okay? And it makes sense, believe me. The nose was created so that spectacles could perch on them. Get it? That was the sole purpose why you have a nose. If you didn't wear spectacles, if mankind did not wear spectacles, they would just have 2 holes, or maybe even 1. But because you wear spectacles, you have a nose. Can I have a round of applause from all the spectacle wearers at least, yeah? Imagine, God created the nose only for you.
Before you start, you know that God created a forehead only for Dr. Lalit's spectacles.
Start. Okay, your time starts now.
Time.
Start.
I used to always think spectacle is something which makes me look ugly. In fact, when I got married, I stood beside Srinivas without a spectacle and I couldn't see half of the people who came to wish me or said me congratulations. I saw Srinivas's face and he was smiling, I was smiling. That was the day I realized spectacles is very important. I started to wear spectacles, but then I had a nose fracture once and that spectacle started to fall down. I thought, oh my God, this is falling down and I'm not able to read, I'm not able to see, I'm not able to do anything. And I got my nose repaired and the spectacle started to sit wonderfully on my nose. And that is when I started to read and I got first prize in my MS, I got first prize in my MBBS. And this is all because of that small spectacle which is sitting on my head, which is sitting on Lalit Verma sir's head, which is sitting on my nose, and that is the way spectacle has to sit. And still there are people who want to get rid of this spectacle by doing all the refractive surgeries which people are sitting over here. But believe me, the nose on which the spectacle is sitting is more important. So rather get a rhinoplasty done rather than getting the spectacle being removed. Keep wearing the spectacle on your nose, and that is the way spectacle has to be.
Time is up.
I think that was excellent. She has, but I have one question for you, Dr. Deepthi. Dr. Lalit Verma does not wear his spectacles on his nose, so should he get rid of his nose? No, but here the nose was created. So, आपका fracture हुआ, sir?
I think we have.
I will not ask you how that happened. I will just give you a hint. It happened during his first year of medical college, and I will leave the rest of the story to your imagination.
I think sir is the only honest person. He doesn't have the Pinocchio's nose to support the spectacle. That's why he's on the forehead. So next.
Next is Dr. Vinita Ramani.
From Eye Openers. Right.
Dr. Vinita Ramani from Eye Openers, can you clap? Come on, you're having such excellent speakers here.
So, Primolal, you want to go?
अच्छा विनीता जा रही है ये भी बोलने में उस्ताद है
Oh, this is so good. This was just written for a lady. So, her topic is, the eyes are the main weapons in the armory of flirtation.
Oh.
And she's an expert on it. So I'm sure she will have no problem. I've met her husband, I've heard all the stories.
Yes.
I think eyes are so wonderful. You can express.
Time has to start. The timer has to start.
Eyes are so wonderful. You can do flirting with all your judges. Look at the nice judges sitting here. You can flirt with the audience. You can flirt anybody over here because it's beautiful and it will give you an impression that whether you are happy, you are angry, whether you are dancing, whether you are liking the person, whether you are not liking the person, but then eyes can befool them and you can enjoy and you can dance with eyes, you can express with eyes, and you can do so many beautiful things with the eye. But being an eye surgeon, you do the surgeries, you look into the eyes, and the patient will come and say, I want to show my eyes. So I will tell them, open wide and then show me the eyes, and then I will flirt with them. So it is very, very easy to flirt with anybody on the world, and even you can flirt with your God, you can flirt with your husband, you can flirt with boyfriend. Boyfriend is always needed, so you should have a boyfriend and you should enjoy. And it is really good to enjoy with everyone, flirting with the eyes.
Time up.
Mani,
I think
only thing is reality तुम्हारा पता लग गया. We have come to know your true reality, flirting.
But tell me something, and I'll go to you, Dr. Kaushik. Tell me something. Do you think being an ophthalmologist, an ophthalmic surgeon, takes the romance out of the eye?
No, not at all.
Not at all.
Not at all.
That's good.
We have
That's
far more opportunity.
Gives you far more opportunities while you're. Yes.
मैं चित्रा बोला इसका असलियत पता लग गया इसका.
Doyle, the most famous song nowadays is "Aaj Husn Ka Maza Aankhon Se Lijiye."
Absolutely.
It's being played in any pub all over the world.
So next we have Dr. Anurag.
Oh.
आज की रात आँखों से लीजिए।
ना भाटिया।
Okay, so his topic is 2020 vision is overrated. Life is more peaceful if seen a little blurred. And it starts now.
Why does it start now? I have 30 seconds to prepare.
Because you're a spontaneous speaker, you
no,
don't need
it
the
doesn't
time.
start now. You promised. This is, see.
It started. Okay.
30 seconds hai.
नहीं रूल तो
Please,
रूल
Duel.
रूल
Are you ready, sir?
17 seconds and 30 milliseconds.
उसको देख नहीं रहा है ready कैसे आप कैसे पूछे he is not seeing you
He's trying to see
Blurred
whether
hai.
there is one eye. You shut one eye and you'll see the reality. And the reality is that we have a short, limited time. This hall is not ours for the rest of the day.
Yes.
Okay, ready to go?
Yeah.
Start the timer.
There was a day when I was not wearing my glasses and I did not have 2020. I identified somebody else as my wife. That was the most peaceful day I had. One of my patients came in, identified one of my assistants as his sister, dragged him along and slapped him. That was the most peaceful day in his life. Somebody identified his bedroom as his lavatory, and that was the most peaceful day in his life. So it is true that if you do not have 2020, at times, your life really becomes peaceful. And talking about peace, talking about topics, such topics in an international, scientific, supposed to be educational meeting can only be crafted by someone whose cerebral sphingolipids have undergone the process of saponification and have been transformed into bongolipids. So thank you so much for the topic. Thank you so much for the perseverance. Here I rest.
Talking nonsense, which he's supposed to.
Duel को हरा दिया.
He has to
There
search
is-
on-
These are most hilarious actually. Sphingolipids, yeah.
You know, sir, when you this is a typical, cowards thing. When you can't speak
Sour
for
grapes.
yourself, you
Sour
attack
grapes.
the person in
Yeah,
front
yeah,
of
keep
you.
on.
Absolute coward.
The losing
And
aggressor's
it's
response.
True.
Carry
It's
on.
true he doesn't have a 2020 vision.
See, aim was to make us laugh. He has done
He
that.
done that. Okay.
So next is eye washes. So you have Swa liquid gel and makeup drop to choose from. So you have chosen Swa Ali Khan. Sorry, what did you say?
Swa Ali Khan.
Swa liquid gel. Sorry.
Free में मिल सुहा free में मिल रहा है. Ali Khan भी.
आप कौन सा
Swa
eye wash?
liquid gel gives you the topic.
I think that's the best compliment I received.
You are eye candy. Eye washers.
Okay, his topic is
यहाँ देखना है.
glasses are the
Don't see there,
only
see
medical
there.
devices people wear to look
देखा,
smarter.
क्या? What is it? Say it again.
Glasses are the only medical devices people wear to look smarter.
ये सारे smarter नहीं हैं.
Time.
अच्छा था.
Ready? Time starts now.
So we are ophthalmologists, the smartest people in the whole medical community. As we all know, if you see the number of people wearing glasses right now in today's time, you go to schools and the number of children wearing glasses has increased so much. That clearly shows their intelligence is going up. The number of people getting smarter today, you look at children, they're using devices, gadgets, much before what we could, and that's all because of the reason that they are wearing glasses right now. In earlier times, number of people wearing glasses was so minimal, they could barely do anything. I would like to ask the respected judges, the audience, at their age, could they even manage thought of manage using a phone or any device of that kind when they were given it at the age of 4 or 5? But look at the generation now, they're so smart. And the reason for that is that the only device which they are wearing is glasses. That's the only thing which has changed over the years. The incidence of myopia, the incidence of glasses going on and going up by the day. So that's why I feel glasses is the most important device to make people smarter.
So before we go on to, that was the end of the jam session, so to say. But before we go on to the next round, which has been reputed to be one of the toughest rounds, I'm going to ask the judges to speak on one of the topic while they get ready, and I'm going to you, sir. And your topic is, we have two eyes, one to see reality and the other to deny it.
I'll come there.
Dwell, it open karo. Dwell, open the laptop for.
The judge is not going to be judged, but yes, the audience, you may clap or you may
Can
boo.
Can I have the timer?
Timer, please. Timer. No, from there, for her, him, the timer, 1 minute timer. The timer. Yeah.
So there is a slight error in the topic. We actually have three eyes. One which is our inner eye, the third eye, the rudimentary pineal gland, which is the one which we need to turn inwards and look at our inner reality. There are two types of reality. What we see in the external world, the Moh, the Maya, that we see with our two eyes which work together in tandem, so you can call that one eye. And the other eye is the inner eye, which we need to look inwards and see what matters to us and what should matter to society. So you work for yourself and therefore you work for society using the power of the third eye, which many of us don't unleash because we are so unaware of it. Unfortunately, in medical college, we are only taught about these two eyes working together. When they don't work together, you call a squint specialist. But what you need to call is a little bit of a psychologist, a philosopher, and expand your horizons by looking at the world with a new eye. That's the inner eye, the third eye, which is hidden from everyone else. It's only yours to see.
It's time
Thank
up,
you.
sir. However, I would beg to differ. I would beg to differ. You do not, you have three eyes. Okay, whatever. Let me tell you, all wives have four eyes. The other is the invisible eye located at the back of the head, which knows exactly where the husband is and what he is doing. So, sir, I will differ with you. So now we are coming to this round called the scramble and scramble round. So what happens in this round is that you're given a word. These are all ophthalmic words. They're all scrambled up. Come up here. Give them a pad and a sun farmer. Give them a pen and a pad. You unscramble as many words as you can. There are 10 words, as many as you can unscramble in 1 minute. Okay? So you can write it down and then call it out after 1 minute is over.
Collect the sheets in the meantime?
Yes, that would be very helpful. Hoymunti, just come up and take Mrs. Scoring. No help. You are no help. Absolutely. See? Look at that. No, each of it will be different. 10 marks. Okay, so the first one to go is Ashish Lal. Dr. Ashish Lal, look here also if you want to. No negative marking, it's tough enough.
You can see it here.
But believe me, this year I have made it easier.
Yeah.
There is a hint at the big at the end.
No prompting. Yeah. So, slide please.
The person who prompts, you are going to come up here and do the next one. And then all of us are going to boo. You don't have to say anything, just write down whatever you can recognize. Okay? At the end of 1 minute, you have to read it out. Okay? Now, there'll be a hint. Okay, so look at the hint and try and think of words that connect. Are we ready to go?
Time starts now. No prompting, please. No prompting, please.
10 words, they're all from the retina. Recognize as many words as you can. Audience, remember, it's only your posture. You're sitting down, so you know it all. Stand up, you'll know nothing. It's all from the retina, so think retina. And by the way, this has been prepared by my juniors, so in case there's something wrong, keep your tomatoes to yourself. You can give them to me, I shall carry them to Calcutta and deposit it on the faces of the people who've made it.
So time is up. How many did you get?
Okay, can you read out? Drusen? Okay, I'll
Drusen, 10 marks.
Okay, so vitrectomy, he did not get his,
No,
get
just
it,
answer
lattice, he
Guru
didn't
Bol.
get. So the answers were Drusen, he got Drusen right, he got melanoma right, and he got retinoblastoma right. So that gives him a 30. That is quite a huge score. Over the years, that's quite a huge score. Next slide.
Next team.
Next we have eye catchers. So you want to stand here? Just next to you, right, Dr. Chitra? I get it totally.
You can sit here as well.
Can I have a pen, please? A pen or a pencil?
Pen I have given to someone. Did I give it to you?
Okay, come. You want to sit here and do it?
Quick, quick, quick.
If you want to sit here, just as long you're comfortable. Okay? Right.
Yeah. Time.
Which team said that the judges
Ready.
is giving you 5
Timer,
extra
please.
marking?
Time starts now.
It's all the cornea.
No prompting, please.
We've kept it very simple this year. Otherwise, usually the score here is rarely more than 10. I never thought I'd live to see the day when I would hear you say those two words.
Hey, don't confuse. Yeah. So time is up now.
Time up, and the answers?
This was for the entire team.
No, that was for her, not the entire team.
Scoring.
Okay, so show the answers. She scored quite a bit. So she's got pterygium right, she's got keratitis right, she's got pachymetry right, she's got microcornea, yes, right. And what was the last thing? Kerato? You haven't written your conus, so...
The time was up. but-
Keratoconus, fine. So she gets 1, 2, 3, 4, 5, 50. That's huge. That is huge. So next we have the eye openers.
Eye openers.
Eye openers, Shalini Mohan, Dr. Shalini Mohan. Where would you like to sit? There? You have the pen and paper? Okay. Start.
So time starts now.
You never know, someone might score all of it. It's oculoplasty, simple. She's sitting there.
Xanthelasma.
Duel.
I think you should look ahead. Look ahead.
Time up.
Time up. I'll take that. Answers. She's got entropion, she's got proptosis, she's got dacrysostectomy, yes. She's got trichiasis, and she's got xanthelasma, and she's got syringing, right. So that was 1, 2, 3, 4, 5, 6. That's a 60. That's a 60. Next, Dr. Samresh. Who's coming? Okay. Yeah, you can go sit on his lap. It's okay. And he'll whisper all the answers to you. Limit to cheating, yeah? Take it to a whole new level. No, ma'am. See, if they look like bubble gum, it's okay. If they're living up to their names, I have awarded them, and see, they've come dressed
So
for
the
you. They were
time-
created for you.
Time starts now.
The president comes from Bongo Lipids. You're next AIOC, you're not there.
Eight.
ये तो pseudo exfoliation है.
So time is up.
Time up. Can I have the answers, please? Okay, answer. He got, oh my God, I think you'll have to read it out yourself. The only one who has a doctor's handwriting here. No, you're not writing. This is, no, I saw. Wait a minute. He wrote 4 answers. So first one is what? Iridotomy. Yes, it starts with an I, so it has to be an iridotomy. Next one starts with an S, so I guess that is synechia, right? Then B, yes, so it'll be ophthalmos. I'm just going on the first alphabet, which I can recognize. And there's a B again, so that would be what? Blebitis. That's it. He got 4 right. That's a 40 for him.
So next is AIOS. Who is from the AIOS? Yeah, you have a pen, 5 pen and paper.
Some of us have done presbyopic IPCL. Come on. So next one. Ready? Team washes. Ready, start.
Ready? Timer.
Start.
There's nothing much to be done, Naveen. Thank you so much. This is the last round going on.
Celebrity eye. 5 more minutes. That will be fun.
Okay. Simple है, nystagmus है.
Nystagmus है.
Time is
Up. Can we have the answers? Show the answers. So it's amblyopia. He's got right nystagmus, leukocoria, prism, and neuroretinitis. So he's got 5 right. That's a 50 for him.
Very nice, yeah.
Excellent.
Very nice.
And we come to the last round, which is the celebrity eyes.
Always wins. Ragini.
So who's the one from the eye poppers for the celebrity eyes? Okay, this time there's a bit of a difference in the celebrity eyes. You have two faces that are merged together. If you can recognize both the eyes, you get a 50. If you can't, you go on to the next one where you'll get a 40. So each attempt, 10 goes down. If they can answer only one eye, you give them half the mark. Is that clear? Hoy Monti, have you got it? Yes.
So, are we starting with the team?
I have a
Yes, we are
suggestion.
starting with
You
okay, we are starting with the
Doyle-
audience.
Doyle,
Just to show you an example. Sit down, you'll get it now. Audience, can you tell me who this is? Anyone? Yes. One of you. Yes, yes, yes. So it's Kapil Dev. You think both eyes belong to him?
No, one side is.
The other one? Okay. So if you can recognize both Kapil Dev and Rohit Sharma, you get a full 50 marks. This is the way it goes, okay? So just show the others in fast sequence.
Yeah, so next team.
So it'll be like this.
Quick, duel, time.
No, go on to the next one.
Eye poppers, eye poppers.
Eye poppers. Who's there from eye poppers? Come up in front.
There is,
Yes,
if
you
you...
cannot guess. If you guess, it's over. There's no,
No,
negative.
zero
If you
you'll
guess,
get
you get a
there.
zero. You don't get a turn. Okay?
Yeah, go there. Yeah, you can... Yeah, you can face the screen. You can face the screen.
Okay,
The
are you ready?
timer.
So these were the two people fused together.
Timer starts now. Yeah,
That's up to her.
yeah.
So you can stand here. If you do not recognize, say a pass, you have just 1 minute. Pass. She says a pass.
Now,
Do you recognize? Pass. Pass. Do you recognize? Do you recognize now? Or is it a pass, Nupur? No, if you guess it's a zero fully. Okay. Anyway, you get a full zero if you can't say so. Smriti Irani, she says. Okay. Audience, can you guess? Asha Bhosle and... Go to the next picture. It's Asha Bhosle and Neha Thakkar. So this team gets a zero, a full zero. Next.
eye catchers.
Who was this? Neha?
Neha Thakkar. So next we go to the eye catchers.
Eye catchers. Timer ready. Yeah, time starts now.
Yes, the two eyes. Indira Gandhi and no prompting, please. You can pass.
No, ma'am, no prompting. You can go on to the next phase if you want.
Next. You've got one right.
So you have to have both rights to get them. No.
You need both.
Yeah.
That was prompted. I heard you. No, I'm not giving that to you, Feroz. I'm so sorry. Please sit down. She gets a 25 for recognizing Indira Gandhi. Let's go down. Absolutely. This, not when she was reading out the budget, I can bet
25.
you. So let's go on to the next slide.
Next team is eye openers.
Get the next slide before you go
Eye
to the next
openers.
team. Put the next slide.
Timer
So
starts
that
now.
was Indira Gandhi. One hint you should have
Yeah,
got by now.
time starts.
Mamata Banerjee. You're not asking about the gender,
We
we're
can
asking about the
move.
person.
You can move to the next slide if you want any hint.
You can't give away the answer. She says Shashi Tharoor, and that is wrong. Can we show now the next picture? It's Jyoti Basu and Mamata Banerjee. Sorry, we cannot give you anything.
25 for Mamata Banerjee.
No 25
So
for
she got 25, na?
Who? Oh, sorry. She
Yeah.
gets a 25. I'm
25.
sorry. I forgot she. So she gets a 25 for Mamta Banerjee.
So next is, yeah. So timer ready? Yeah. Timer.
1 minute, 1 minute. She's saying the answer. Yes. Yes, Dr. Samresh.
Please don't prompt. Yeah, I'm going. Timer ready? Yeah. Sorry. Sorry. Timer reset.
I know.
Okay. Can we have the answer? That's Ranbir Kapoor. Next slide. You are giving away the answers. I like your ploy, you know. You're doing fantastic acting. I heard the answer here and you didn't. Oh, really?
Do it.
If you go to the last one, you'll get just that score, huh? So be careful. Huh? I mean, I don't know what you're doing. You're just making your scores go less because I can hear the hit right from here. Fine. Raj Kapoor. What did he get it on?
Last one.
No.
Last
but two.
Yeah.
So he gets a
10 and
50, 40, 30. He
no,
goes with the 30.
25 and 10, 35. 35. So that brings to the
Very
end.
well done, Dr. Samresh. And then we come to the last one.
Ready? Yeah, timer. No prompting to help the other team.
Sharmila Tagore, he says. Do you want to pass or do you want to guess the other eye? Next. Next. That's because. Next. Come on. You said that. No. Okay, fine.
Okay.
This is the way you want to play it. It's all yours. You want to keep prompting. I'm standing here and I'm hearing the prompt and he's not. And he's from my hospital, so I know him well. I know exactly how much he can hear.
Okay.
I know exactly how much he can hear. I know. Next time we'll ask you with your nose to the screen.
So,
So yes, that's Sharmila Tagore and that's Anushka Sharma.
so 25 and 10 we have to give. 35.
5. We'll give you 25 and 10.
35.
35.
So can we get the mark sheet?
Fine.
So
Give them a 10.
we'll fight it over the lunch.
1 minute.
अभी आप भाग सकते हो. अभी आप भाग सकते हो.
1 minute.
You have to give the prize.
1 minute. Just 1 minute.
Kyle, do you have more pictures?
No. As the moderator and the founder of this game, I give this team 10 points. They're absolutely right. Please add 10 points. Please add 10 points to Dr. Chitra's team. And then she corrected it within time. That's eye catchers.
Eye catchers.
I know it's unfair. No, I know it is unfair on you. But the unfairness comes from the audience. If they do not have the spirit with which to play a game. Absolutely. So let's come with that.
जो ज़्यादा बोलेगा उसी को मिलेगा.
Chalo, we are done.
You also shout.
Okay, judges, here is the thing. You can either subtract from the teams who were prompted Or you can add.
I agree, subtraction is better.
The thing, I know who all I heard prompting, so I can tell you.
Vision is yours, subtraction should be written.
He says subtraction. Wait a minute.
She heard, she heard.
So if you're going for subtraction, so the judge says we are going for subtraction a little bit about the marks.
I have looked into the marks. Even with addition or subtraction, it is not making any difference
So-
to the price.
What? Wait a minute. What Shugato is essentially trying to say in simple English is that even with addition or subtraction, the cheaters do not win.
Come what,
So,
come what may,
can
come
we
what
have
may,
the-
genius,
have the
genius,
marks
genius.
now?
Yeah. So from the marks, yeah.
अरे नहीं अरे रमानी
as-
वो कह रहे हैं उसके बाद
Yeah,
फर्स्ट उसके
even-
बाद भी फर्स्ट वही है
even with
You know what?
yeah,
You know
I'm
what?
coming to
I
that.
have a suggestion.
Yeah. Duel, one second. Even with addition or subtraction, we have first two prizes. It's not making any difference.
Okay, fine. Anurag says that is different, so subtract 10 from his team. They were prompted. Okay. And subtract 10 from him. Subtract 10 from the last team. They were also prompted. And Dr. Chitra, there was prompting here also. So, of course. But as we say, there's no difference.
shouting
So,
से negative हो गया.
yeah, they're 10 points also.
So I'll just give this. Yeah. So, yeah. So the
winning team.
The prize are given away by Sun Vision
Can we have Sun
for
Vision
the
now with the
second
prize?
team. 5,000 rupees voucher for each team member, and for the first team 7,000 rupees voucher for each team members. So
Sun, can we
no,
have
not
you
cash,
out
it's
here?
Amazon voucher.
Vouchers or judges?
Yes.
Mohita?
Yeah. So I hope they will
So we did
purchase
have
Sun
vouchers for the
Farmers
judges
eye
the
drops with
last
those
time.
vouchers. That's what they have suggested. 5,000 rupees ka Sun Farmer drops they have to purchase. Yeah.
Oye.
No. Okay. Yeah. 1.5 each. So the second team is eye washes.
Oh,
The second team is eye washes.
Ragini, celebrate now only.
And the winners, guess. Any guess?
Candies.
Eye candies.
Oh. Anurag. Despite and in spite.
Yes.
Can you have the score? There's serious doubt. Where is the score? Where is the score? Where is the score sheet?
Hey, all of us, let's say 3 cheers to Doyle Vishwas and Dr. Sugato Paul for making us laugh the last 1 hour.
Listen. Okay.
First, judges prize for Doyle. Judges prize. Sugato, judges prize for Doyle. Actually, next time, quiz master will be. Next time, quiz master.